Welcome back to a time when brave individuals faced the challenges of surgical procedures without the benefits of modern anesthesia. Welcome to the Neuro Bites channel, where we will take you on a journey through the ages to uncover the secrets and techniques that ancient people used to enhance their lives aesthetically and surgically. Forget about anesthesia, as we guide you through the world of surgery before the era of painless operations. So, hold on tight, because an exciting adventure into the past awaits us. Now, before we step back in time, don't forget to subscribe to our channel and hit the notification bell so you don't miss a single moment of this fascinating story. Let's explore together the secrets of aesthetic surgeries before anesthesia. Understanding anesthesia. How it works. Before we delve into how aesthetic procedures were performed before the era of anesthesia, it's crucial to understand what anesthesia is and how it functions. What is anesthesia? Anesthesia is a medical procedure used to eliminate pain during surgical operations or other medical procedures. Additionally, anesthesia can induce a state of consciousness that allows patients to be pain-free and unaware during surgery. There are several types of anesthesia, but the primary distinction lies in three main categories: general anesthesia, regional anesthesia, and local anesthesia. How does anesthesia work? General anesthesia. In general anesthesia, the patient loses complete consciousness and does not feel pain or have awareness of their surroundings. This is achieved by administering medications, typically through intravenous infusion or inhalation. An anesthesiologist monitors the patient's condition throughout the procedure, maintaining the depth of anesthesia and ensuring safety. Regional anesthesia. Regional anesthesia is used to numb specific parts of the body, allowing the patient to remain awake and aware while the rest of the body remains pain-free. Examples include epidural anesthesia for childbirth and nerve blocks for surgical procedures on the arm or leg. Local anesthesia. Local anesthesia is applied directly to a small area of the body to numb it and prevent pain. This is commonly used for minor procedures such as tooth extractions or suturing small wounds. Components of anesthesia. Anesthesia consists of three main components: analgesia, amnesia, and muscle relaxation. Analgesia. This component is responsible for pain control. Anesthetic drugs block pain receptors in the nerves and the brain, preventing the transmission of pain signals. Patients do not feel pain during surgery, although they may sense pressure and touch. Amnesia. Amnesia means a loss of memory about events during anesthesia. Most patients do not remember anything that happens during surgery, a result of the amnesia induced by anesthesia. Muscle relaxation. In some cases, surgeons may require complete muscle relaxation to facilitate a surgical procedure. Anesthetic drugs that cause muscle relaxation are used to achieve this effect. Achieving the state of unconsciousness. The state of unconsciousness, or the absence of awareness and pain, is achieved through careful dosing of anesthetic drugs. These drugs are typically administered intravenously or via inhalation. It is crucial to maintain a balance between the depth of anesthesia and patient safety throughout the procedure. During the achievement of the state of unconsciousness, an anesthesiologist monitors the patient's vital signs, including blood pressure, pulse, blood oxygen levels, and other parameters. Additionally, electroencephalograms, EEGs, and other monitors are used to ensure stability and safety during anesthesia. Effectively achieving the state of unconsciousness is critical for the smooth progress of a surgical procedure and the reduction of stress and discomfort for the patient. Now that we understand the components of anesthesia and how the state of unconsciousness is achieved, we can return to exploring how aesthetic procedures were performed before the advent of anesthesia. Aesthetic procedures before anesthesia. A glimpse into the past. The history of medicine is a tale of human resilience and innovation, and there is no better example than aesthetic procedures. Long before the discovery of anesthesia, people sought ways to address dental issues, undergo surgical procedures, and enhance their appearance, albeit with significantly more pain and risk involved. Tooth extraction. In the Middle Ages, especially in Europe, there existed a practice of tooth extractions that was associated with cruelty. Dentists were often ordinary merchants or individuals without formal education in dentistry. This period was marked not only by painful extractions but also the potential loss of other teeth due to unprofessional procedures. Surgical procedures. In the 17th century, during the early development of surgery, especially in Great Britain, surgeons often held low social status and worked in inadequate conditions. Painful limb amputations and surgical procedures were performed without anesthesia, often using gruesome instruments, and patients endured immense suffering. Cosmetic procedures. During the Tang dynasty in China, 618,907, women used amber needles to inject color for permanent makeup. This process, though aesthetic, was extremely painful and risky. The needle literally punctured the skin, accompanied by intense pain and the risk of infection. Psychological impact. Besides physical suffering, aesthetic procedures before anesthesia left lasting emotional scars on patients. The fear of doctors and procedures, as well as the trauma caused by intense pain, remained a part of many lives. Assistance during procedures. In the absence of anesthesia, the role of assistants and those present during procedures was crucial. Kind words of support and physical presence provided patients with much-needed comfort during painful procedures. The history of medical procedures before the advent of anesthesia bears witness to the harshness and cruelty of that time. Examining these periods from the past sheds light on how medical practices have evolved, allowing patients to receive more painless and secure treatments, while also expressing deep respect for the progress in medical care that we have the privilege to experience today. As we've seen, the history of aesthetic procedures before the advent of anesthesia takes us back to a time when brave individuals endured immense pain in the pursuit of improving their appearance and health. Today, we are privileged to live in an era of modern medical advancements where painless and safe procedures are the norm. To learn more about fascinating historical stories like this one and related topics from the world of medicine, don't forget to subscribe to our channel, Neurobites. Click the subscribe button and the notification bell to stay updated with all our future content. Your support helps our channel grow and enables us to share more educational and intriguing stories with you. Thank you for joining us, and we'll see you in the next video.